Hello, everybody. I just wanted to take a little bit of time and talk to you guys about coronavirus. And I know that a lot of you are getting a lot of information, and because I'm getting calls from friends and family from all over the country that are asking me, what is the truth, what is not. You're hearing information that is changing literally day to day. And so now our schools have been closed. But I think the thing that really got people on edge was when they shut down the NBA. Now, a lot of stuff had been going on, but when they said there were going to be no more NBA games and no more hockey games, the world panicked. It's like, oh my gosh, something really bad must be going on. So I'm at the house, just like y'all are at the house, and I thought it'd be a good time for us to talk about it because you may have a lot of questions, and what happens is we start sharing information with each other that may not be the truth. You know how that happens. So I want to give you at least the truth as I know it and as I see it, and from the information that I have gathered from a medical perspective, so that I could try to kind of ease some of your concerns and try to give you some information that I think you can really use. Now, I am a family practice doctor who's now a concierge doctor. I am not an infectious disease specialist, but you are probably not going to get to talk to an infectious disease specialist because they are very, very busy. And it is your primary care doc that everybody keeps telling you to call. They keep saying, well, if you have a question, call your doctor's office. And what's happening, you're calling your doctor's office and they don't have any answers for you. So I'm going to tell you some of what's going on. So first of all, let's start with just the basics. Now, you need to know that COVID-19 or coronavirus 19 is a virus. So some other things that you know are viruses. Influenza, which causes the flu, is a virus. The common cold is a virus. HIV is a virus. Ebola was a virus. So you go from things that are really pretty mild to things that can be even life-threatening. All of those are viruses. But this is the thing about COVID-19. It's a new virus. Now, let me tell you what that means when I say new virus. It's not new to the planet, but it is new in that it has mutated and can now infect humans. So it's been around, but it was in other species, but now it can infect humans. So that's important to know. Whenever something new infects us for the first time, we have an immune system. Everybody knows about our immune systems. We talk about how we want our immune systems to be strong and that kind of stuff. Well, we have this thing that is part of us is when we get exposed to something that causes us to be sick, our body remembers it and forms antibodies. Y'all following me so far? So it forms antibodies. So the next time you see that thing, your body is ready to fight it. When it is a new virus, you have no antibodies. So because you have no antibodies, now your body has to get geared up to be able to fight it. So it takes a little longer, so it has a greater chance of making you sick because you can't fight it off. I hope that makes sense to you. So that's why, it's important, and we're kind of like, what do we do with this? So that's one thing, it's a new virus, and we don't have antibodies. The other thing is because it's a new virus, there is no medicine for it and no vaccine. So for other viruses like flu and that kind of stuff, we have specific medicines targeted at those viruses. We do not for this yet. So what they are doing now is looking at antivirals, that's what you call medicines that fight viral infections. They are looking at antivirals that we have already and testing them on the COVID-19 virus. So it'll take several weeks to know which ones are most effective, if any, and then when they figure that out, they'll say, okay, we can give this viral or antiviral to treat COVID. Does that make sense? Okay. Then the other thing is we have no vaccine. Now, a lot of y'all wouldn't take the vaccine anyway, so I try to get you to take the flu vaccine. You won't do that, but that's another conversation. So a lot of us were not going to take that vaccine anyway. Go ahead and admit it. But in the event that they do, and they will develop a vaccine eventually, but it takes a long time to do vaccines. So no matter what you heard, it is going to be about a year before a vaccine is available. So that is coming up the way. So you know there's no treatment. Now, what we can do in terms of treatment is give what you call supportive treatment. So supportive treatment means if somebody is sick and they're really sick, they're in the hospital, their lungs are really infected, then you can say put them on a ventilator or something like that until their bodies have time to kick in, and we can do things to kind of help them breathe better and to keep them going until they're able to overcome the disease. So I hope that kind of helps you understand why it is important that this is a new disease. Now, I've had people ask questions, and I've seen it online. I'm on social media like y'all are. Did somebody create this? We are not going to have that discussion about our conspiracy theories, because this is what happens. Many of us are still getting infected with HIV. You know why? Because we were having a conspiracy theory conversation as opposed to a protection conversation. So we can talk about that later, but first we need to keep ourselves well. What we understand about viruses is we don't really know why they will mutate and now become pathogenic to the human species, but it happens. There are some things in science we can't tell you the why, nor can we tell you the when, but we can tell you that it happens, so it does. So the other thing about this virus, so when you look at a virus, then you got to know who is susceptible to this virus. Every time they talk about this virus, they call it the deadly coronavirus. So I think much of that is what's scaring people to death. It can cause death in people, but so can the flu. This is a much more virulent virus, and I'm going to tell you what that means. It appears to be a virus that causes more illness and more death, but still it's small relatively. So in people that are under the age of 60, now I'm going to tell y'all, this made me nervous because at first they were saying that senior populations were very susceptible, and I thought, oh, that's not me. And then they said age 60, and I was like, okay, Lord Jesus, that's me. Anyway, but under the age of 60, most people do very well. So under the age of 60, the mortality rate, when you hear the term mortality rate, that means death rate. The death rate is somewhere between 0.2 and 0.8. So a 0.2% mortality rate means 2 people out of 1,000 will die. A 0.8 mortality rate means 8 people out of 1,000 will die. So does that put that in perspective for you? But the mortality rate for older people, for people who have underlying conditions, the underlying conditions that they're talking about is high blood pressure, diabetes, heart disease, and lung disease seem to be where this is really adversely affecting people. And then people being over the age from about 70 to 85, that mortality rate goes a lot higher. So in people in that age, I've seen numbers everywhere from 8% to 15%. So let's say if it's an 8% mortality rate, that means 80 people in 1,000 will die. So that number is bigger, but still 920 will survive out of 1,000. So y'all follow me? I want you to know that so you can put that in perspective. So when you're hearing things like mortality rate and those kinds of things, you won't just freak out. But yeah, Big Mama needs to stay at home. And all of the people who are susceptible and have, yes, you need to stay at home. Okay, so there we've got that. We've talked about who's susceptible to it. It does not seem to affect little children very much, so young people seem to be pretty good. That's important. But this is the part that they're not sure about. They're not sure whether it just is that little children don't get any symptoms, or that they're really not catching the disease. So they think that for some reason little children are able to not be infected as often with coronavirus, and when they do, they're asymptomatic. But the thing that's of a lot of question is whether or not, even if they have no symptoms, they can spread the disease. So that's why they're shutting down schools and stuff, because young people, they think children could possibly have it and they not have any symptoms, but then they could spread it to other folk. So that's why they're pulling in the schools and that kind of stuff. But we're going to talk about a little bit later about why you're shutting everything down, because I think it's really important to know why they're shutting things down. So this is what happened when this virus first came into people, and we know it started in China. It made the jump from animal species, birds or something like that. It made the jump to people. And then it started to spread like wildfire. Now, there are some things about this particular virus that makes it such spread so easily. First of all, it has a long incubation period. Let me tell you what an incubation period is. That means that you can have the virus, be infected, have the ability to affect other people, but have no symptoms yourself. So why is that a problem? Because I think I'm well, and then I'm going out into the community, touching things, touching people, sneezing, coughing, that kind of stuff, and I'm infecting other people who they don't know they're sick for 2 weeks. So when that starts to happen, you have what we call that silent transmission period, when lots of people are getting the disease and we didn't even know there was a disease available. So that's why the Chinese shut everything down. Now, we're a democracy, so we can't tell people you got to stay at home and make them. But they were able to do that, and so they shut it down. So they stopped the transmission rate that was at first shooting to now, when you hear them talking about that curve flattening out, what they're talking about is they have slowed significantly the number of people that are getting infected. So I hope that makes sense to you. So at first, when people were being infected, we said, well, either they had visited China, or they had been to Italy, or they had been to one of the other places where there are hot spots. But now, in the last week or so, there has been a turn. And what has happened is, now people are getting infected with the virus that had no contact or exposure to anybody that was from one of those hot spots. So now we call that community acquired, which means it is in the community. There is no reason for us to know or even think this person has it or these people have it, but they do, and they are transmitting it. That's why it has become an emergency, because now it is on surfaces and it is in other places and we don't know it's there. And so we've got to shut things down so we can stop the transmission of it. So that's what community acquired means. And that's why it went from, I think we'll be okay. Although the scientists were always saying, look, we need to do something. This thing is going really rapidly. But there were some other people in the society that didn't really think that this was a big deal. But now it has officially become a big deal. Okay, so now let's talk about what the symptoms of coronavirus are. It's a little bit confusing because it's a lot like the flu. The symptoms are like the flu, and so they are all over the place. For some people, it's like a mild cold, and so they have a little respiratory stuff. They may have a little bit of a cough, not a lot of congestion, but a lot of respiratory things. So cough, and people who get really severely ill develop a kind of pneumonia. And so one of the big symptoms with coronavirus is people are short of breath. And so one of the ways they are triaging, and to triage means to kind of sort out in the emergency room, one of the ways they are sorting out people who are really ill and those who are not by checking their oxygen saturation. And so if the oxygen saturation, what you call an O2 sat, some of you guys have heard that term before, if the oxygen saturation is low, then they think this might be a person that really might have this virus. So I know I'm giving you a lot of information, but I think this is stuff you need to know so that you will be able to function and talk intelligently and not be listening to the stuff that you're hearing online. So that's a little bit about the symptoms. Now let's talk about testing. So last week I watched the news like y'all watched the news, and we all saw that it was presented to everyone that testing was now available and anyone who wanted a test could get a test. Okay. As a physician who has an office and who has patients calling asking about the test, that was not the truth. The test was not available to everybody. As a matter of fact, we only got tests available in our office on last Friday. Well, that was yesterday. So we only got tests in our office on yesterday, but now we have tests and we don't have the proper equipment in our office in order to test people safely and not put ourselves at risk. So your doctor may have the test, but if your doctor doesn't have the right face mask and the right other stuff, they still can't test. So initially, when the tests became available, they were limited. So we finally got the test. Now we don't necessarily have all of the rest of the equipment. And then initially there were some guidelines. So testing was very, very, very specific and strict. So there was something called a PUI, which is a patient or person under investigation for this virus. There was a list of questions. So let's say you went to one of the big university medical centers, you presented, and they looked at you and they thought this person might have coronavirus. They evaluated you, went down the question and answer. Even if they had the test available, they had to get an okay to test you. Now, because scientists have balked against that so much, in the coming weeks, there will be more tests available. Now we only have limited tests. There are just a few tests. So now they have to be very strategic about testing. So just because you think you have coronavirus, you may not be able to get the test. And I want you all to know that and understand that it's not that the doctors are not testing you because you are from a particular neighborhood or because you are from a particular ethnic background. It is because we don't have the test available. And so that's why people were getting the runaround. They called their doctor would say, call the health department would say, go to the emergency room would say, call your doctor. And so you would be going around and around in a circle. And then even if you were one of those people who were admitted to the hospital, you still may not get the test because of those guidelines were put in place. Now, those things have since been lifted as of, I believe it was yesterday, but now it's going to be a couple of weeks before the whole system ramps up where they will be able to test more people. I hope that's helpful and you can follow that. Now, who's going to get tested? All right. You look on TV, and I think in New Rochelle and Washington State, they are doing those, what we call localized testing areas, where you see the people that look like they're walking on the moon, and you drive up and let your window down, and they swab you and do a test on you. They are looking in our area to be able to do something like that, but that is going to be several weeks in the making. When that does occur, that still doesn't mean everybody will be able to get tested, because there's two things. One is how many tests we have available, And two, how many people we have available in the labs to process those tests. So we can swab 1 million people, but if we can only process 100,000, then the rest of those we have swabbed in vain. Are y'all following me? I want you to know that. So some of the panic and the anger and all of that stuff, you have good, solid information so you can know what to anticipate. So that's on the testing part. So keep your ear to the ground, and if I need to come back on, y'all let us know if we need to come back on once the testing starts to try to guide you through who's going to be tested and who's not going to be tested. Now, let me tell you something. If you have something that you think is coronavirus, do not, and they've said this on TV, to go to your doctor. Do not go to your doctor's office if you think you have been exposed to corona. Do not go to your doctor's office if you think you have been exposed to coronavirus. Do not go to the emergency room if you think you have been exposed to coronavirus without first talking to someone. And I'm going to tell you why. Everybody who's exposed to this virus has to be quarantined. So if you walk into your doctor's office, even while we are waiting for your test to get back, that means everybody in that office who had contact with you now has to be quarantined. So that means you have knocked out the receptionists, the nurses, the medical assistants. All of those folk are now in quarantine, and they can't take care of the rest of the folk. So if you think that you have been exposed, talk to somebody first. Now, there is opening up more access to telehealth. I think this whole pandemic has given kind of a boost to the need for telehealth. So that means if your doctor has telehealth available in their practice, I do, because my patients, as a concierge doc, part of what they can do is talk to me on the phone, or I can do a telehealth visit for them. If you think that you have coronavirus, and obviously you're not, so short of breath that you think you're about to meet Jesus. If you think you're about to meet Jesus, go to the emergency room, have somebody either call ahead for you. What I would do is call the emergency room and say, I have a patient who's coming that I think may have been exposed. Then they will tell you what to do. If not, go to the emergency room. If you don't have a mask, send whoever drove you, because if you're sick enough to go to the emergency room, you're not driving yourself. Send whoever drove you into the ER and say, can we please have a mask? We think that this patient may have been exposed to coronavirus, and they will tell you what to do. You do not want to present yourself in the general population. If you call 911 and you think it is the coronavirus, tell the folk, I think this may be coronavirus, and this is why. So our first responders won't be walking into that situation as well. Does that make sense to you? So you don't want to just walk in, you want to call. Now, be prepared for some changes in the way medicine is practiced, period. I was talking to one of the major university medical centers, because I've been calling all of the major hospitals. I've been on conference calls, all of that, because I want to make sure that I give the best information possible. One of the major health centers here in Dallas, the way they handle people who they think have coronavirus, once they arrive at their emergency department, they put them in isolation, and they are even evaluated by the doctors on staff via telehealth. So the doctors don't go in the room. The doctors actually interview them through a camera system. And then if they are tested, they talk to the infectious disease people and make the decision whether to test them. So expect some of that you may have to talk to people via telehealth. That's important. If you have a doctor who does telehealth, you may want to talk to them via that. I want you to know that those things are coming. The other thing is, They are making changes in whether or not you can go into a nursing home or not, because one of the hot spots was somebody exposed nursing home patients, and they had just a large fatality or mortality rate because somebody took into people who were already debilitated an illness that took their lives. So now many of the nursing homes are limiting who can come in. The hospitals, if they are not already, are limiting who can come in to see the people who are sick. Some of them are going to stop from bringing little children into the hospital because we don't know about their transmission rates and that kind of stuff. So don't think that people are just trying to treat you ugly. What they are doing is trying to make sure that we take care of people. So that was all of the information I wanted to give you, but this is what I want you to do now. If you have a question, put it on there and we can now answer some questions. Do we have any questions?
Yes. If someone believes they have been exposed to the virus, what can they do at home to relieve the pain and discomfort?
Okay, so I don't know if y'all heard that question, but it was, if somebody believes they have coronavirus, what can they do at home to take care of themselves? You take care of, if you're not really, really ill, and let me tell you what really, really ill is. Really, really ill is you can't breathe, okay? So you're getting where you're very short of breath. You can tell if you're starting to decompensate and get really sick. But otherwise, you stay at home. You do the same things that you would do. You drink warm liquids. You take something for fever, a Tylenol or something like that. You eat good, healthy foods if you can tolerate that. Hydrating yourself is absolutely critical. So warm liquids really help. They particularly help with the mucus and just help you to feel better. You isolate yourself in your home. And so the rest of the people in the house will not be getting exposed to it, and then call your doctor and ask them what you want to do. I would monitor my patients and just check, with them back and forth and make sure that they were okay. But that's a very good question. Next question.
What are prevention tactics?
What are prevention tactics? That's a very good question. They have told us about washing your hands and staying away from crowds. Don't sneeze on people. And those are great things. But y'all ought to know better than sneezing and coughing on people. There is nothing that irritates me more than folks sneezing and coughing on you, because I don't want what you have. But anyway, don't sneeze on people, don't cough on people, that kind of stuff. But this is the other thing. Things that help to boost your immune system. Rest is critical. Eating healthy foods is critical. The things that allow your body to heal itself. I'm real big on plant-based. I'm not just big on that whole food plant-based just because I don't have anything else to do, but it is because that's the stuff that will give your body what it needs to heal. So, eat those vegetables. There are good anti-inflammatories, turmeric and those kinds of things, vitamin C, all of the things that you would always do to help to protect yourself from colds or flu or any of that stuff. That's what you do to help protect yourself from this virus.
Does swabbing the inside of the nostrils with betadine help prevent the virus?
I wouldn't swab inside of my nostrils with betadine because betadine can be caustic to that. But I believe in washing out your nose because, that's one of the places. So some saline solution to rinse out those nostrils, I think, is a good thing for you to do. And just taking care of yourself overall. And there's a lot of things online about washing your hands, but I want to just give you a little quick thing. You wash your hands, get the soap in there, wash your hands, wash the back of your hands, wash between your fingers, make sure you get the thumbs, wash your hands like this so you can get the inside of the palms of those fingers. Then you want to go around your nail beds so that you have washed around the nail beds, then underneath your nails, and then at the end you want to wash the tips of your fingers, thumbs, and then rinse. So if you do all that, it's going to take you 20 seconds or more. But hand washing is so important, and you can decrease your risk of catching any communicable disease that's spread, by touching and that kind of thing by as much as half by just washing your hands with some soap and water, y'all.
Is there anything one can do to bolster respiratory health and or function during this time?
The same thing that I said before. If you take care of your body, one of the things that thickens secretions is dairy products. We also know that dairy products cause a lot of inflammation and those kinds of things. Just eat healthy. Make sure that you're getting some fruit. Make sure that you're getting things that are naturally high in vitamin C. Make sure that you're getting dark leafy greens and you're getting berries and you're getting whole grains and those kinds of things. All of that will help your immune system to be well, will keep your lungs healthy, will keep your kidneys healthy, all of that. Next question.
Okay. At this point, would you recommend social isolation from athletic centers, i.e. gyms, recreation centers, Zumba, etc.?
I would be very careful with that. So I'm glad you brought that question up. The question was, would I recommend isolation from things like gyms? Listen, when you talk to various people, you get a different, answer. But let me tell you what my opinion is on that. First of all, let me tell you why they've done the social isolation. Let me give you an example. Let's say you have a restaurant and your restaurant can feed 500 people a day. Okay? So you have enough food, you can feed 500 people a day, but you only got so many tables, right? You can feed 500 people a day, but if they come in at 20 or 30 at a time, and so all day 20, 30, 100 come in, you can handle that. But if all 500 show up at once, you cannot handle it. That's what they're trying to prevent by doing social isolation. If everybody catches this virus at once, it will overwhelm our health system. And so we will not be able to take care of people. If everybody needs a ventilator because their lungs have gotten sick, we don't have that many. Of course we don't. So if you think about that and think about if we all just, back in the 70s, we'd say lay low. But if we all would just, isolate ourselves, separate ourselves for just 2 or 3 weeks, then what happens, the people who have the virus, their immune systems will knock it out. They will no longer be contagious. Then it won't have a host to carry it, to spread it to other people, and we can possibly control it. And the other thing is then everybody, if we continue to catch it, everybody won't have it at once. And so we'll be able to better care for those people. And I think it's very important to say that because one of the things that happens, particularly in those of us who are Christian, we tend to spiritualize everything. So we will say, how is it that people who have faith, will shut down a church? Okay, they are shutting down the church because they are being responsible. We do not want to expose folk to something they don't have to be exposed to. You may be fine, but Mother Johnson may not. And so stay at home. Faith will work at your house like it will work in the sanctuary. And so that was a little preaching, and I don't preach. But I think that if we understand, then we are not so critical of the decisions to be made. And then this is the other thing. In medicine, a lot of times when you hear the information, you think we are sensationalizing it. As physicians and healthcare providers, we have to prepare ourselves for the worst case scenario. If we are prepared for the worst case scenario, then everything else we will definitely be able to handle. You don't want us to prepare for best case and then worst case hits and we're not prepared. So that's why it sounds to people who are non-medical that it is being overblown and sensationalized. It is that what we want to do is be prepared for the worst case and hope for the best case.
What should you use at home for sanitation?
Good question. So a lot of us, we're careful about things like bleach and that kind of stuff. because I coughed, and so my crew is looking at me like, why are you coughing? Okay, I don't have anything, I swear. I just had a little, am I right though, y'all? Don't worry about it. But y'all send a prayer up. But anyway, a lot of y'all are really, really careful about things like bleach and some of those kinds of things because they have some toxicity. But I am telling you, go ahead and use your bleach and what have you, and open up your windows if you need to, because we want to kill this virus.
What are some of the questions on the list? Is shortness of breath the only and main one?
On the list?
I think they're asking.
No. That list was at least a page of little bitty writing. It was stuff like, have you traveled? Have you been exposed to somebody? All kinds of symptoms. I mean, there's a lot of questions. And then after you answered all of those questions, then they would talk to somebody, either infectious disease or from the Center for Disease Control, to determine whether or not you got it. That's a question that I think that was one of the bottlenecks for being able to test people originally. And I think that's been resolved now. That is actually more of a political issue than anything. And I think it is a conversation that needs to be had after we get past this crisis. We don't want to drift into that right now. But, you know, if you're one of my friends and we're at dinner or something, I'll tell you what I think.
Do you need some water? They want to know, do you need some water?
They just don't treat me well, do they? I am probably going to need some water, but I'm okay. I'm really good. Thank you so much for asking.
One of the questions that came up was, is vitamin C good? You answered that.
Yeah.
Vitamin C is definitely good.
Well, you know, you want to make sure you get a good multi. And the most important you can do is eat the colors of the rainbow. I don't know how many times I have said that, but I promise you, eating the colors of the rainbow are critical. And there's going to be a lot of people out there that's about to get mad at me when I say this. But when you are on a high protein keto plan, you suppress your immune system and you increase inflammation. I'm not having a conversation about that. It is what it is. Okay, next.
If you have health issues before the virus, what should you do? Should you isolate?
Yes. If you have health issues and you know that you are generally not well, don't put yourself in that position. Go to stuff that you have to go to. And I want to say to other people who happen to be younger and are at less risk for this particular infection, if you are going to the store and you know that your aunt or that your, grandmother or your neighbor even is in that high risk group, ask them if they need you to bring them some bread back too. We are going to have to collectively as a community help each other and care for each other. And now we're at home with our families. We don't have to talk to each other. It really is, it's an opportunity for us to really get this new 2020 vision. As we go forward and trying to decide what to do for ourselves, we're going to have to reconnect as human beings. And there is nothing better than a good old crisis to make us reconnect as human beings.
What about the elderberry supplement?
Now, I'm so glad they asked that. There are no tests against this virus because it's new. I personally am taking elderberry. This is not medical advice, but taking elderberry cannot hurt you. I am taking elderberry myself. Yes.
Should I increase my daily vitamins, multifolic acid, vitamin C, D3, etc.?
No, because, your body only needs what it needs. And so taking big mega doses of vitamins can, cause harm. So just take your regular dosages. Make sure you hydrate real well so your body will flush out what it doesn't need, but you don't need to mega dose up.
Okay, I think we'll wait a few more minutes for a few more questions.
So we'll wait a few more minutes for a few more questions. And if you know people who were not on this Facebook Live, who you think needs to see this, share it with them. Be careful where you get your information from. Don't think just because the information changes that the scientists are going back and forth and can't make up their mind. This is an ongoing fluid situation. So we are learning new information every day. It's just like when they update your iPhone or your iPad. You don't consider that a nuisance. You consider that now they have something better. So when we update information in medicine, it is not that we are confused. It is not that we have 2 or 3 stories. It is that the information has changed. And when information changes, so do the recommendations.
What about echinacea?
Echinacea is not going to hurt you if you are have an active infection. This is the one thing that they recommend with echinacea, that you don't take it every day unless you are infected. So let's say you have a cold or something like that, you take echinacea during that time, because if you take it ongoing every day, the studies show that it actually suppresses the immune system.
What about Carlson ACES plus zinc for the immune system?
I don't know if that's a product, but zinc has also been shown to help boost the immune system.
Okay. What if you have pets? How should you keep them safe and sanitary and healthy?
Well, actually, I was listening to something today. I have been listening to so much and reading so much, and they were talking about that dogs are actually immune to coronavirus. So I don't know about other pets, but I know that dogs, right now, it is not a pathogen that affects dogs from what I heard today. But that may be a good question for your, what do you call it? Your dog's doctor. Veterinarian.
Okay. We said, what should we do? Children, should they avoid food that has been handled by other people, including pizza delivery, etc., due to possible contamination?
Well, that's the risk you run when you order food and somebody brings it to you. I kind of have an issue with people bringing me food that's been, I don't know what they did to it in the car, but don't let me start another thing. But I think you should be careful. I saw something earlier that said, should you wash containers? I think that, I try to wash my cans or whatever, those containers anyway. My grandmother always washed all of that stuff. Just do use some good soapy water. You got to wash your vegetables and stuff anyway. It's not going to hurt you to wash the outside of those packages with just some good soapy water and rinse them off if you're not going to wet the food with the chemicals or with the soap.
Okay. Apple cider vinegar, does it help? And should we do it daily to reduce and help your body fight off the virus?
Actually, no. What apple cider vinegar really does is it's more of a diuretic than anything. And it has some other things, that you can look up and see. But I'm telling you, good healthy food. You are not going to be able to do one supplement, one vitamin, one anything that is going to keep your immune system doing what it needs to do. One essential oil, one this, one that. You have to look at it from a holistic approach. Am I giving my body all of the things that it needs to have in order to repair itself and to be well?
Okay, what about emergency? I think that covers that.
Absolutely, yeah, because it's got a lot of vitamin C in it, and it's got the other multivitamins in it.
Once you get the virus, will you be immune?
Actually, I was looking at an interview about that today. We really don't know yet because it's so new. They haven't looked at people who've had the virus to look and see whether they have antibodies. With other viruses, once you have been exposed to it, yes, your body does make antibodies. So I cannot answer that question from a scientific perspective at this point.
Will raising your temperature help dissipate or destroy the virus?
You know what? Raising your temperature, thank you so much for that question. If you have a sauna in your house, elevating your body temperature even a little bit, that's why things like exercise work, things like getting in the sauna work, because the reason you run fever when you are ill is because your body elevating its temperature is a way for it to try to kill the pathogen. So if you are able to get in a sauna or elevate your temperature, say with exercise or anything like that, just a little bit, that does help you to kill a lot of a lot of pathogens, and I would imagine it would be the same with this virus.
Two things, okay.
Yes.
Are teenagers at a great risk like adults? And also, what about family coming in and out of the home? Decontamination when you come inside?
I have young people. One of them is behind the camera. I have a 25-year-old and I have a 19, almost 20-year-old.
Ooh.
And every time, don't be oohing. And then every time they come in, I think about, did they wash their hands? So this is what I would have you say to your teenagers. Wash your hands. You know how our mothers were. Don't go in my kitchen without washing your hands. Don't go anywhere without washing your hands. And I think that if we do that as a family, it's really, really important. So yeah, I would speak to them about washing their hands and their faces. That's real important.
I missed the question earlier. Will you do a demonstration live just for washing hands?
I will. Do y'all really want me to do a hand washing thing?
Yes, be a hand model. Honey.
I'll be a hand model.
Yes,
I will. I'll do that. We'll film that and put it out there for you so you'll know how to wash hands. Because in medicine, when we are training, you train for surgery. And period, hand washing is such an important part of medicine and keeping ourselves healthy and keeping you healthy. And we just don't do enough of it anymore. It's crazy. So this sounds like a really basic thing to have to teach people how to wash their hands, but it's basic and worthwhile.
What about homemade sanitizer and disinfectant?
You can do those. There are several DIY, do-it-yourself disinfectants and that kind of stuff you can find online. Most of them need to have like some kind of bleach or some kind of bleach or alcohol in it to be effective against this virus.
Someone asked about essential oils.
Essential oils. I was reading some stuff today, and I think that there are a couple essential oil companies that are really getting a bad rap because there are some people online saying that you can use a specific essential oil to fight this virus. This is a new virus. There are no tests to tell you whether a specific essential oil will kill this virus, but I use essential oils. So this is what I know. You can use essential oils as part of your general routine to keep yourself well and healthy. Like I said before, if you think that one essential oil is going to knock this out, it's probably not. But as part of your overall wellness regimen, I think it's a good idea.
In the demonstration on washing hands, can you please include how to turn water on and off with clean hands?
Yes, ma'am, I will. Thank you so much for giving me all the specifics on that. But I will. Because, it's real important after you wash your hands, you definitely want to not take your clean hand and turn off the water. You want to use whatever you've dried your hands with to turn the water off.
Can you repeat what you said about the gym?
What I said about the gym was, I think that I don't even know that I really answered that question. I think I kind of veered off or ventured off on talking about why we were kind of saying that you need to stay away from people. The gym is a real interesting place. I mean, there are people sharing body fluids. You are sweating and doing all of that stuff. So I personally would not go to a public gym right now. I just give it 2 or 3 weeks. Now, there's a bunch of stuff you can do at home. I'm not saying don't exercise. I'm just saying you don't necessarily go to the gym. Now, a small private gym, it may be great, or a gym that wipes things down. I know I used to go to the gym at the hospital, and they had, you walked in the door, and they had everything that you needed to wipe down the equipment. Not just wipe it down, but to sterilize the equipment. And so if you're going to use it, I say, get you some bleach wipes or some other antiseptic wipes and wipe that equipment down.
Is a combination of zinc, elderberry, echinacea, vitamin C okay in moderation?
Yeah, I think that combination is okay. Just for your immune system overall.
Which essential oils do you recommend for daily use?
Ooh, it depends. There are a lot of them. And if you look through some of my previous things, I actually did a whole videos on essential oils that you can go and pull those back up. We'll repost those for you, so you can pull those up to make sure that you have what you need.
Is it safe to swim at the chlorine public pool, a city recreation center, etc.?
It should be. I don't know. I really can't answer that question. I would imagine so. I don't know what the Center for Disease Control is saying about that. I would look at their website. Oh, and so I'm glad that I thought about that. You can go to CDC, which is the Center for Disease Control website. You can go to the WHO, which is the World Health Organization website. I'm sure that the Dallas County Health Department has information on their website. So you can look at all of those, and I bet you can find information on most of those questions.
And we'll get it posted on your website as well.
Yes, we'll get it posted on my website as well.
Can you repeat what you said about apple cider vinegar?
I said as part of the best thing about apple cider vinegar is it's more of a diuretic than anything, and so that it helps to lower blood pressure, and it's okay as part of your whole wellness regimen.
A doctor mentioned that once you've had the coronavirus and recover, you still have a 20 to 30% lung damage. You could possibly still have.
Yeah.
What is your knowledge?
That's one of the things that they're looking at. Again, because this is a new virus, we don't really know what the long-term sequelae are. But because it can affect the lungs so much, there is a concern that there may be some ongoing, at least temporary. Again, it's new, so we don't have 2 years, 3 years, 5 years worth of research on it. But it could be that you have some ongoing kind of issues with the lungs. Now, for most people, what they're thinking is that small percentage of lung damage or continuation of lung issues won't be a significant health issue. And the other thing we don't know is after a few years whether your body kind of heals itself or compensates, where it doesn't matter at all.
What about steam showers if you don't have a sauna?
Steam showers are good. All of that's good stuff.
Do you think that antibiotics from a person who has gotten over the virus can be used to make the vaccine?
Antibodies. That's what they did with Ebola, and I'm sure they're trying all kinds of stuff right now. This is so new that they are trying everything that they can to try to control this pandemic. Y'all know what pandemic means. That means that it has covered the globe. So that means that there are a lot of really smart people in a lot of places trying to work through what to do in order to contain this virus.
Should we really not meet at all, even small gatherings of 10? Sorry if this was answered, but...
Well, there are some scientists that are saying don't, and there are some that are saying do. But I think everybody agrees that if somebody is sick in your group, you tell them, no, girl, you stay on at the house. But, but small gatherings, you have to, if you got a small gathering. In my house, I always have a small gathering because I have my daughters and I have their boyfriends or fiance, and then I have my mother-in-law, and, so we always have a small gathering. So for most people, if you have a significant family, you have, 10 or 12. So let me tell you about this. Whenever you have to be separated, there are some people who are by themselves. And so is it going to significantly risk your health to go over to a friend so you're not there at home by yourself? I really think that it is so important for you spiritually to be okay, that if you are well and they think they are well, go on over there. Because people don't do well when they're by themselves, and we know that. So I say go on over there.
Does Lysol work as a
Yes,
sanitizer? Okay.
It does.
Someone says I have hand sanitized my credit cards and money when I exchange. Is that okay?
You know what? Actually, today I went to get gas, and I wore a glove and pulled that glove off. Can you give me a glove? Because I want to show people how to pull off a glove and how to get, I have some in the there's right there's a face mask. Mm-hmm. So I want to show you But yes, you can use hand sanitizer or you can use soap and water. I'm actually washing my cell phone off every day with soap and water. So those of you who have masks, I think it's important to know how to wear a mask. You put your mask on, hook it around your ears, tuck it under your chin. There should be a wire right here that you have on. When you take your mask off, when you take it off, it's very important that you take it off and grab those handles and drop it in the trash and then wash your hands. Because then and a glove, the blue gloves, they're gonna get some gloves for me because I want to teach you how to pull off a glove, because you could contaminate yourself with the glove even though you did it. But yeah, hand sanitizer is good because as long as it has some alcohol in it. But the best thing for everything is some good old soap and water.
What advice for staying safe would you have for people that are forced to work in the public in retail or restaurants with hundreds of people coming in and out?
You got to wash your hands. You got to try to stay 3 feet away from them. If somebody is coughing and sneezing, you want to get out of their space. And because everybody cannot stay at home. So I just need one. So let me tell you, so protect yourself as best you can. You do, again, keep your immune system boosted because you're going to encounter folk. We all are. Because we haven't been able to test, we don't know who has this virus. So we just all have to be diligent in taking care of ourselves. So I want to show you how to put a glove on and pull it off. So when you put your glove on and you've done whatever you want to do, this is real important. When you take off a glove, you don't grab the fingertips to take it off because now you have just contaminated anything. You get the back of the glove, pull that glove down, turn it inside out, and drop it in the trash. That's how you take a glove off so that you don't contaminate yourself with the glove.
If you go out, do your leather gloves prevent germs or do they protect your hands at all?
Sure they do. Okay. Absolutely. You just want to keep them clean.
Okay. Is any food now being a part of contributing to this virus?
No. And Corona beer is not either. So, y'all, I was at a physician's conference last weekend, something. My time runs together. And it was actually kind of a legal conference, and one of the corporate attorneys told us that they had done surveys, and 38% of people surveyed believe that coronavirus has something to do with Corona beer. And so, that's how bad information goes. But no, there are not any foods or anything like that have been associated with this virus to my knowledge.
Does having surgery put you at risk of catching the coronavirus?
No, you mean just in the hospital or whatever. I will tell you, hospitals and particularly surgery suites and that kind of stuff, they are very, 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 very diligent about trying to keep germs under control. That's why it's cool in there. That's why, they have you bathe a certain way, all of those kinds of things. A respiratory virus is what it is. You don't have any more risk having surgery while this virus is around than you would before.
Does chiropractic care help maintain the immune system?
Well, that's a good question for a chiropractor, but what chiropractic does is helps you maintain overall good health by keeping alignment and that kind of thing. And overall good health does help your immune system.
Isn't the N95 mask the most effective one? The one you wore helps, but...
Yeah, and you can't get the N95. So when I was saying a few minutes ago that we can't get those in our office, they have been all directed to go to the hospital because those are the people that are the first line. So you are correct that the N95 mask is the most effective. But if you can't get it now, unless you got some already.
What if you had or have an ear infection or stomach infection? Can you be at high risk?
No. I mean, any infection, anytime you are sick, your immune system is suppressed or your immune system is trying to fight off that other infection. And so adding any other illness is a problem. So if you are sick, stay at home. stay at home. Okay, guys, it seems like this was great because you all asked so many questions, but we've been on for forever. And I just hope that this was helpful. Everybody stay well. And we haven't talked about it a lot, but pray that this is going to happen, but you need to pray and wash your hands. So anyway, y'all have a wonderful, wonderful day. You can follow me at AskDrJill.net. You can look on Twitter at AskDrJill, Instagram at AskDrJill. I will try to post as much information as I can. When I think it is relevant, I will not put foolishness up there. So when I post something, I think it's something that you need to know about. So thank you all for tuning in. Please share this information. And be careful what you share, and be careful that you don't share bad information.
Let's do one more question.
One more question.
Why is this virus gaining more attention? You mentioned this at the beginning, but I think some people are still...
because it's a brand new virus. It's a brand new virus and has several particular features, like it has the long incubation period and has a high mortality rate in older people and people who have underlying medical illnesses. We have no specific treatment for it, and we have no vaccine for it. So, and now it's a pandemic and has gone all around the globe. So it is rightfully getting the attention that it needs to get.
You had a few more questions, so we came back on live on Instagram. So where do you buy masks?
This one obviously is from my office. You can try to get them online. Just about every place is out of mask. I actually have a patient who called me and said, I'm going to have to fly next week. Can't find a mask anywhere. And they are saying, now we are being told that if you are well, you don't need a mask. But if you are sick, you need a mask. And I can't tell you where to find them now. It's very, very difficult to find a mask. But look online, so they may start coming up, because a lot of masks were made in China, and China's been shut down.
I think that's it.
Okay. So blessings and love. Y'all take care of each other and take care of yourselves.
We'll keep the videos posted so that people can continue to share them.
So. Yeah, please share. All right.